good afternoon, good evening, good morning, where you find yourself. Today, I'm going to talk about the menstrual cycle. Okay, so if you look on the board here, we have a menstrual cycle of two different people, starting from July down to August and to September. Okay, now we have two colors here. Okay, the black color and then the blue color. Okay, good. The black color for July starts from second, third, fourth, fifth, and sixth. And this dark or black color crossing is for Afia. Good. And then we have the other color crossing, that's the blue color crossing, that starts from 10th, 11th, 12th, 13th, 14th. That is for ya. Okay, so this cycle here, this is calendar, this 3 months calendar are for two people, Afia and Ya. So they can all be put on one table like this. So let's start the whole concept. For Afia, I'm crossing over. Okay, for that of Afia, I'm using the color black. So Afia in July has her menses from second, third, fourth, fifth, sixth, 5 days. So if you come and look here again, then there's another cycle here for Afia. On the 30th, 21st, 1st, 2nd, 3rd. That is for Afia again. Okay? If you continue to August, Afia will have another cycle starting from 27th, 28th, 29th, 30th, and 31st. And then lastly, a cycle will be repeated, her menses will be repeated from 24th, 25th, 26th, 27th, and 28th September. Okay? So let's try to find out for Afia first. Okay? So if you look on the screen, July, Afia had her menses second, third, fourth, fifth, sixth, 5 days. And then in August, the menses started a bit earlier in July. Okay? 30th, 31st, 1st, 2nd, and 3rd. That's also another 5 days. So between the two cycles, or the two menses, or the menstrual flow, how many days? If you count carefully, the 2nd to 29th is 28 days. Okay? So Afia had a menses for 5 days, and it repeated on the 30th. So from 2nd, if we count up to 29, that is 28 days. Okay. So when you give you a question like this, you have to check. So in July, Afia had 28 days in a cycle. What about in August? Let's check August. August started a bit earlier in July. We have 30th, 31st, 1st, and then 35 days. And then the second one started 27th to 31st. How many days? If we count carefully, from 30th to 27th, the last day here is 28 days, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28 before the next cycle starts, okay? So it means in the month of August, a fair cycle is still 28, okay? If you go to September, if you count 5 days menses, and it also started at another 24th. So from the 5 days menses to the 23rd is another 28 days. So if you look at a fair cycle is constant. 5 menses, 28-day cycle. In August, menstrual flow 5 days, 20-day cycle. In September, menstrual flow, it started a bit earlier, okay? Ended in August 31st, but the cycle ended at 28 days. So Afia has 28-day cycle, okay? So we can say that Afia, the cycle of Afia is 28 days. And then the menses, if you look throughout the menstrual flow, 5 days. So that's what you need first, okay? So each time we give you a question like this, you pick out each month the cycle. So since all the cycles in the 3 months are all the same, that's why I wrote 28 days, okay? And then the flow is also the same throughout the month, 5 days. So if here is 28-day cycle, 5 days in each month. Let's take Ya. Ya started her menses. I'll use other lines for Ya, okay? I'll use just 2 rounds here and for Ya, okay? So Ya started her menses on the 10th, 10th, 11th, 12th, 13th, 14th. So I'll put this dot here so I can signify areas that Ya had a menses, okay? So Ya had a menses from 10th to 14th. And again had a menses from 7th down to 11th. That's also another 5 days, okay? So if you check from Ya in July, her menses started from 10, ended 14, and then started again 7. If you check the duration, that is also 28 days, okay? And then it also started again in August, started from 4th, and then ended 8th, okay? And another one started in September. That's, yes, ended, that is a September one, okay? Another one also started from the 2nd of the next month to the 6th of that month. That is October, okay? Good. So if you look at Ya cycle, the cycle of Ya is also a bit constant. 5 days of menses and 28 days of cycles. So I'll say Ya is also 28 days, and then menses also 5 days. So perfect. So it means both ladies, okay? So when we see crosses and fear, whether we see this dot is here, okay? So it means both ladies have 28-day cycle and menses menstrual flow 5 days. But the variation between them is that each of them start in a different day. Now, what do we need in this table? One, we need to know conception period. Remember, when we're doing uterine cycle, we said that uterine cycle starts from menses, and then the growth, and then the growth is the proliferative phase, and then we go to the secretory phase. Okay, and between the proliferative and the secretory, we have something we call the conception period. Okay, so if you look at Ya, for instance, Ya menses in July, 2nd to 5th, safe period, start right after menses. 1, 2, 3, 4, 5. So safe period of Ya is also from 7th to 11th. Okay, and I said usual conception start from day 11 to day 17. So from Ya, conception will start from 12. Let's have it from there. So 1, 2, 3, 4, 5, 6, 7. Okay, let's count again. 1, 2, 3, 4, 5, 6, 7. So conception for Ya is from day 12 to day 18. What does it mean? It means that from day 12 to day 18, that is where ovulation might happen. We put a 7 day side that if ovulation delayed, it will be captured. If ovulation is earlier, it will also be captured. Okay. So actually, since she's 28 days, ovulation is supposed to be 14 days. That's a normal thing. So if you count well, 14 days will fall here. Okay. So 1, 2, 3, 4, 5 menses. 1, 2, 3, 4, 5 say period. That is 10, 11, 12, 13, 14. Okay. Here. Okay, so actually the 15th day is the ovulation. However, we start from 12 and we end at 17. Why? So that when ovulation comes early, it will come between 12, 13, 40 to be captured. If ovulation delayed, it also be captured. That's why the conception period is put 7 days. Okay, so when they ask you in July, the conception period of a year, the conception period of a year starts from day 11 to day 17. Okay, that's the conception period of year. That is when, yeah. So after conception period, all the other days after the next cycle are same period. Okay, that's the uterine cycle. Okay, so understand uterine cycle has to do with the menstrual flow, the growth, the secretory, and within that we can have implantation. That's what we call conception period. Okay, when you conceive within 5 days, it will be implanted in the uterus. Okay, if you come to August, the same thing for ya. The menses of ya started a bit earlier in July. So 1, 2, 3, 4, and ended the 3rd of August. Safe period. Safe period start from 4th, 5th, 6th, 7th, and 8th. That's the 5 days. Conception period in August start from the 9th. So let's count 1, 2, 3, 4, 5, 6, 7. So the 9th to the 15th. That's the conception period of a year in August. Okay, 9th to 15th conception period of the year in August. So I think it's easy. You can do that of September too. Okay, so that is year. Now that is Afia. What about that of year? Okay, that of year are these small cycles. In July, year's menses started from 10th, 11, 12, 13, 14. That is 5 days. Safe period 1, 2, 3, 4, 5. So from 15th to 19th. Conception period of year will start from 20th to 27th. So 20th to 26th. 1, 2, 3, 4, 5, 6, 7. So this is a conception period of year in July. Okay, so understand that menses, safe period, conception period. After conception period, all other days are also safe period to the next menses. Okay, so that is for year. So you can do all for July, August, a table your own. Okay, you can draw this nice timetable, the calendar, and do that for yourself. From July, August, September, you can do all these for year and year. Now let's go to the ovarian cycle. You see, ovarian is when we check estrogen, when we check FSH, when we check LH, when we check progesterone. Okay, this is 28-day cycle, so it will be easy for you to understand. Now, in 28-day cycle, estrogen is checked the same day as FSH, okay? Day 11 or day 12, okay? LH is checked at day 14, and then progesterone is checked at day 21. That's why we have 21 days progesterone. Remember, during menses, we don't check hormones. During menses, we don't check hormones. So when they ask you which of these days we don't check hormones, in July, we don't check hormones for Afia from 2nd to 6th. In August, we don't check hormones for Afia somewhere from 30th to 3rd. In September, it follows that way. Okay. For year, the same thing. We don't check hormones for year from 10 to 14. Why that we don't check hormones during menses? During menses, all hormones are down. Estrogen, all hormones are down. So we don't check hormones for during menses. But estrogen, FSH, LH, and then progesterone can be checked. But it's better to check them at their peak stage so that you can easily know exactly when to allow these things to happen, when to check them, and when not to check them. Okay? So from July to August, this is a small calendar that you can draw. I want everybody to draw it for themselves and then demarcate the cycle. So the cross is for Afia, the round is for Ya. You do 28 days for each of them. Okay, you count from menses to the next menses. Okay, 28 days, that order. Now you can know exactly how to check. So what about if a person is 30 days? 30 days, people bleed for 7 days. So 30, 28 is 2. You just need to add 2 to everything. So if we check LH, for somebody that is 28 in 14, 30 days, LH is checked half of the cycle. LH is always half of the cycle, okay? So half of 30 is 50, so day 50, okay? If somebody is 26, half of the cycle is 30, okay? So LH is always checked half of the cycle, okay? What about checking the other hormones like progesterone? In 28-day cycle, progesterone is checked every 21 days, okay? So for 30 days plus 2. So as for estrogen, progesterone, FSH, and any other hormone you want to check, for 30 and 20, the difference is 2. So you just need to add plus 2. But remember, for LH, half of the cycle. Okay? So quickly draw this July to August, and then draw your own and check each of these. Remember that the basic question that we can ask you here is conception period. When is the conception period in August for Afia? Should be able to calculate that. What is the conception period in September for Yard? Should be able to calculate that. Remember, conception period is 7 days. And right for menses, 5 days for menses, 5 days for same period, and the next day conception. Do you like a conception period start? Become for 7 days. Why do we do that? So when ovulation delayed is to capture, when ovulation is too early, to capture the mate. Okay? And then we are asked couple to have sex any other day. Because remember, the mature sperm cells are saved at the tail of the penile. Refill of them takes 48 hours. So any other day is the best time. So 7 days maximum is a sex period of 4 days. Okay, because the sperm cell can stay in the oviduct of the lady for 72 hours. Okay, so any other day is the best for them to get there. So please try to mimic this and then practice everything that we've done. That's why I've started with the basic, how to draw your menses to the next month, to the other month. You know how to calculate for your cycle. So for Afia, 28-day cycle, 5-day menses. Okay, it's the same. And you should be able to read each other passing through the other lines, the other cycle. Okay, so when you do that, ask yourself few questions. The uterine cycle, the menses, which day in August did Ya had a menses? In August, Ya had a menses from 30th to 3rd August. Okay, sample is all reading there. And then proliferative phase, and then know that it goes with secretory phase. Estrogen is checked day 11, day 12. LH half of the cycle, progesterone 21 days. There are other 2 hormones that we need to talk about. Prolactin. Prolactin and testosterone also are other hormones that impede people infertility. Okay, prolactin can be checked with any other hormone except during menses. Okay, so you can check prolactin any of the days. You see, when people have high level of prolactin in them, it's a bit worried because prolactin as a stunt, when it's high, you as if your body is already pregnant. So conception becomes a problem. Estrogen is already doing you. But the bigger problem is not even fertility. When prolactin is high in you, we are thinking about pituitary tumor. Okay, people with high level of prolactin have bigger pituitary glands, and then headaches always, and then at times they can have blood issue because the chiasma crossing of the optic nerve is anterior to the pituitary gland, which can pitch onto it. Okay, so when people are looking for fertility issues and they come with prolactin, high level of prolactin, the number one cause of it is not only fertility. We look at beyond fertility. We look at pituitary tumor and other things. Okay. Another hormone to consider for females has to do with testosterone. It's produced by the testes in males. That's the hormone that gives us hair, body hair, musculature, and everything. Ladies don't have testes, but it's secreted in them from the suprarenal gland. Okay. So the amount of testosterone in ladies should be minimal. When ladies have too much of that hormone, they develop body hairs like males, facial hairs, they have muscles, and then above all, the FSH is affected. So the follicles cannot even grow enough, okay, cannot mature enough. So they don't mostly ovulate, okay. PCOS setting, polycystic ovarian syndrome, okay. So dealing with these fertility issues and hormones, number one thing that you have to be aware is how to draw your chart. Number 2, how to put your figures there to demonstrate between each of the chart. Okay. And then number 3, how to be able to ascertain each day that we check the hormones. Okay. So this is a quick revision for you during your examination. If you still had luck or you still don't get how to check the hormones, how to check each of the cycle, that's why I demonstrated this particular PowerPoint for you. Remember, these are 3-month calendar on one chart. We can have 2, we can even have 1, we can have 2, we can have 3. And we can put 2 or more people on the same chart. Okay, so I'm going to end here. If you have a question, don't hesitate to put it at the comment section of this video. I'll gladly answer you. Okay, take your time, look through this, reconstruct it on your own, and of course, I know you understand it perfectly. Until then, we meet again next time. Bye bye.